To yield to my good friend from Indiana, cardiothoracic surgeon, Dr. Larry Bucshon.
Thank you, Dr. Rowe, for yielding. It's great to be here with many members of the Doctors Caucus. And again, remember the focus of what we're trying to do here is focusing on the patient, what's best for the American people and our patients. And it's already been quoted a number of times today. I got a couple other quotes. Senator Schumer also said, Affordable Care Act could cause rates to go through the roof, and that's exactly what we're seeing in the private health insurance. And I won't repeat Senator Baucus's statement about a train wreck, but Senator Rockefeller also said it's so complicated, and if it isn't done right the first time, and it's not being done at all, it'll just simply get worse. And what I'm going to focus on now the rest of the time is talking about what this means to employers and people that have employer-provided health insurance, and what this law is going to do to employers. Let me focus on first what the city of Long Beach, California, just came out and said recently. They're going to be limiting most of their 1,600 part-time employees to fewer than 27 hours a week on average. So these are employees that had a 40-hour work week, and now they're being cut to less than 40 hours to comply with the law. And why, you say, well, why would that happen? Well, because city officials say that without cutting payroll hours, new health care benefits would cost up to $2 million more next year, and that expense would trigger layoffs and cutbacks in city services. This is a city in Southern California. So this isn't an isolated event. Regal Entertainment Group, the nation's largest movie theater chain with over 500 movie theaters operating in 38 states, recently said they plan to cut many non-salaried employees back to part-time to comply with Obamacare. In a memo to company managers, Regal stated, to comply with the Affordable Care Act, Regal had to increase our health care budget to cover those newly deemed eligible based on the law's definition of full-time employee, which is 30 hours or above. To manage this budget, all other employees will be scheduled in accord with business needs in a manner that will not negatively impact our health care budget. Let me the translation. Translation is everybody's getting cut back to less than 30 hours, and they're going to see their income dramatically drop. There's other examples: the state of Virginia, Palm Beach State College in Florida, CKE restaurants, and among others. And I have an example in my district. We got an email the other day. A constituent said her and 52 other employees at a school district in my district in Indiana were recently informed that their hours will be cut to 28 hours a week because the school can't afford to comply with the health care law. Municipal government officials are telling me, city government officials are telling me in my district, this may hit city government, municipal government, county government, school districts. And this is just people being cut. Now let's talk about people losing their health insurance. And here's a chart right here that says, you know, we were promised that everybody could keep their health insurance. Here's some what I consider conservative estimates of the number of Americans who are going to lose their health insurance after full implementation of the law. Why is that? Well, because I talk to small business owners all the time who have more than 50 employees, and I talked to one young man who has been very successful in starting a business and creating jobs, and he says, not only will I probably not be able to afford it and have to pay the penalty rather than complying with the law, but I don't know a small business owner that I've spoken to, this is his words, that is not going to pay the penalty and not going to jettison their employee-provided health insurance. And all of those employees are going to be forced to go to these state-based exchanges, which aren't set up and which are going to cost more, according to the gentleman from Maryland just talked about that about half an hour ago. So people aren't even going to be able to afford it. So employer-provided health insurance is going out the window. I think estimates like this are very conservative, according to the people that I talk to.
The gentleman yield.
I will yield.
Here's what absolutely amazes me about, and I'm glad Senator Baucus mentioned this as a train wreck. I wrote an editorial about it 3.5 years ago describing the train wreck of TennCare. But that's not what I want to talk about. What I want to talk about, Dr. Bucshon, is that we have people right now today, for instance, in Medicaid, a system that, what do? We expanded a system that was already broken. If you look at surgical outcomes for Medicaid patients, they're worse. The outcomes, a huge study, 800 and something thousand patients done by the University of Virginia, those outcomes were worse than people that did not have health insurance coverage. So why would you expand a program that's already broken? Why don't we fix that first? And I know Dr. Fleming has talked about this at length.
Will the gentleman yield for a second?
I'll yield back.
I practice in southern Indiana, where I get patients from southern Illinois, northern Kentucky, southern Indiana. Every year, the Illinois Medicaid system ran out of money before the end of the year. September, October, they just ran out of money. No money for their Medicaid population. This is exactly what you're talking about, Dr. Rowe, is that a system that's already broke, and we're going to expand it. And what it's going to do is, like Dr. Fleming said, put a card in your pocket that says you have health insurance, but you don't have any access to health care providers except, guess where? Through the emergency room, which is one of the biggest problems we're already trying to defeat. And I yield back.
I thank the gentleman for yielding for just a moment. Why do our low income, I've always thought this, why do our lower income patients deserve different care than somebody else? They don't.
They don't.
And they do not. And they should get the same care and deserve the same care that anyone else has. And maybe the president, when he said, I'll go over this bill line by anybody who wants to, maybe he should have taken that up with us and gone over it with the Doctors Caucus line by line, because we came here in a totally nonpartisan way. This health care should not be a partisan issue. Dr. Bucshon is taking care of numerous cardiac patients with heart attacks. He doesn't know whether Republicans or Democrats, could care less. They're just patients who need care. I yield back to the gentleman.
I would agree with that. And let me tell you, there are some things that we could have agreed on, that we could have made some advances on in health care reform. Pre-existing conditions, all of us agree. I had a patient that had Hodgkin's disease when he was in his 20s. He'd worked his entire life. He's now in his 50s. He needed bypass surgery. Never able to get health insurance the whole time because of a pre-existing condition. That's just wrong. I yield. Dr. Fleming.
I just wanted to expand a moment on what you were talking about, small businesses, critical. I'm a small business owner myself, apart from my medical practice. We employ around 500 employees. Many of them are entry level. Their businesses and business owners across America this very moment is in a state of panic. Mr. Speaker, businesses across the country are this moment, because of Obamacare, in a state of panic. And the reason is because of what you said. They're calculating if they have more than 50 employees, they've got to ratchet below them if they can. And they've got to know how much of the punishment, or penalty I really should say, but it's more like punishment, they can absorb for those employees that they can't afford to pay for their insurance. And this is having a direct impact on our economy and on job creation. So this is something that's critical going forward, what this is doing to small business, which arguably employs about 75% of Americans.
Well, the gentleman yield.
Yes.
I just spoke to a physician today from Massachusetts, and he said what had happened there, and what's not clearly understood by the public, unless you're in this line of work, you don't, so much as how the payers pay. Medicaid, for instance, pays about 60% of the cost of actually providing the care. Medicare, and let's say private insurance is a 1, Medicare would pay about 90%. The people they added in Massachusetts paid about the same as Medicaid. And what happened was big insurers, big corporations with lots of employees could negotiate a really good price, but small business could not. So when the hospital had bills to pay, they shifted those costs to private business, forcing their premiums up and up and up and up. And that's why you're seeing those premiums for small business escalate till you really force them out of business. And we talk about the exchange, and this is what is absolutely frustrates me, is that the 1st of October, I cannot even tell the people who work for me. This is a person who works in Congress, who is a doctor, who understands health care. I can't even tell the people who work for me here in the Washington office, in my office back in the district in Tennessee, what the health care premiums are going to be or how they're going to get the health insurance coverage, and that is 90 days from now. I can't tell them. You can imagine what other businesses around, but I can tell them this: I bet it's going to cost them a lot more money. And I yield back to Dr. Bucshon.
I'll yield for a few final comments again on the things that we could agree on. Many of us agree on children up to age 25 or 26. A lot of us agree that we need to look at finding ways to expand the affordability of health care. Remember, this was supposed to bring down the costs. There's a lot of things that could be done to bring down the costs. There's a lot of things we could have agreed on, Dr. Rowe, if we would have just worked together and not put in what I would consider a near government takeover of the entire system. And as a practicing physician for 15 years, and then counting my residency more than that, I think, imagine if you're out there a physician today and you have to look a patient in the eye and you have to tell them, well, I'm sorry, the IPAB told me that this is not statistically something that we can provide because based on statistics calculated in Washington, D.C., it's not cost effective for the Medicare system to provide this service anymore. This is going to happen, and I hope we all wake up in America and realize it will happen. This happens in other countries that have government insurance. The Canadian system could not exist if it didn't sit next to the United States. It's two-tiered. People come to the United States if they have money to get health care in a timely manner. Same thing's true in England. If you have money, you get private health insurance. If you don't, you wait for months. So this is bad for patients, bad for business. There are things we could have done. It's a shame that we didn't, and we weren't consulted. With that, I want to thank the gentleman from Tennessee for this hour to talk about this, and I yield back.